Good afternoon, Down Syndrome Association of Houston. You are joining me, Kim Torres, your Executive Director, today for our Lunch and Learn session where we will be discussing speech and feeding and how they interact together. I hope you've been enjoying our short little quick 10 to 15 minute bits of information throughout the last couple of weeks since we are all stuck at home learning together. Before we get started, I will let you know that I am not a certified occupational or speech therapist. I am a executive director of a Down Syndrome Association and the mom of a kiddo with Down syndrome. And so everything that I'm going to be providing you today is insight from working with parents who have kids with Down syndrome and from being Hayden's mom. If you would like more specific information on some of the details that we are going to talk about today, then you can go ahead and contact your occupational or speech therapist, or contact us and we'll put you in contact with one of them. So I'm going to go through 5 things that I feel like I learned over the past almost 10 years relating to speech that are very important for all kids, I would say 10 and under. The first one is speech can't wait. It can't wait. I distinctly remember the first experience I had with a speech therapist was when Hayden was diagnosed. And those of y'all that don't know our story, he was diagnosed at 8 months old, so we got a late diagnosis. But the very first thing with the conversation I had with the speech therapist was that we don't do speech until your kiddo's about 18 months old. They don't need speech. If there's one thing I've learned over the years of working with families in the Down syndrome community, that is not true. Speech cannot wait. Speech therapy needs to be provided. It needs to be provided regularly. It needs to be provided in a manner that can be embedded into their everyday lives. Speech is very, very, very important component to their therapy puzzle that we put together. The second bit of advice I would give you is to ask for a feeding consultation. A lot of times you'll get speech therapists that'll come talk about speech, and you'll get occupational therapists talking about fine motor skills, and no one is talking about eating skills. And so I always like to urge parents to reach out and ask for a feeding consultation. This should be done by someone certified in feeding therapy. A lot of times it will be just a plain occupational or speech therapist that does the evaluation, but we've been lucky enough to see some amazing feeding therapists across this country, and I highly recommend getting one of those evaluations done. The evaluation will look at how your child chews, how they use their tongue to move food around, how they swallow, all of that type of stuff. So why is that important? Because eating is exercise for your speech muscles. Eating is how we exercise these muscles right here, and we need to be doing it correctly. We need to be chewing correctly. We need to be moving our food around our mouths correctly. Moving our food laterally is one of the ways that typically developing kids build up that muscle strength in their tongue to be able to make all of the sounds that we need to make in order to speak. The other thing is eating and chewing and swallowing and tongue movement is a safety issue that we need to make sure that our kiddos are doing correctly. And so we spent lots of time, years of time, working on chewing correctly so that we were chewing with our teeth and our tongue wasn't sticking out and propelling food out of our mouths, and so that we could eat safely and build up that muscle strength to be able to speak as well as we can. So tip number 4 I had was that texture matters. My husband and I tell this story to people all the time about crackers. we had the world's best feeding therapist when we lived in Peoria, Illinois. You know who you are if you're watching. Hi. She had us pair every piece of food that my son ate with a little bit of a Ritz cracker. Because what Ritz crackers do, and you can go try this out on your own, is they add texture to your mouth. When you chew them, you can feel those crumbs everywhere. So you actually have a heightened sense of understanding where your food is in your mouth, where other items like a grape, for instance, are very smooth and it's kind of hard to tell where they are in your mouth, or it's harder, especially for our kids with Down syndrome. And so for an entire year living in Peoria, Illinois, we would sit at the table. It would be Scott, Hayden, me, and someone would take his food and pair it up with a cracker and then place it in his mouth so that he could chew it correctly every single time. So my tip for you here is texture matters. I get parents that'll call in and say that, my kiddo's not swallowing correctly, so the doctor just recommended Pediasure. Just drink a lot of Pediasure. I'm not saying that's a wrong answer. That could very well be a correct answer in some situations. But I know for us, the way we got our son to eat more and healthier was to pair with a cracker. And that way he could feel the food in his mouth and he could chew it correctly and safely. And so we moved past needing liquid diets or pureed diets in a relatively good timeline. My last tip would be that placement matters when you're working with feeding therapy and making those muscles grow and build themselves to create better speech. Back to my cracker story. So everything got paired with a bite of Ritz crackers, and then everything got placed in the back of his teeth back here. So that meant my fingers went into his mouth for every single bite. And I know you're thinking, God, how did you have dinner? I promise you, I didn't even it just became part of life. My husband and I would talk our day out, and I just went food, cracker, Hayden's teeth, food, cracker, Hayden's teeth, bite after bite after bite. And what that did was that got his food to be in the correct location for that very first bite, that very first chew. And then we worked on using his tongue to lateralize it back and forth. If you are totally lost in what I'm talking about right now, just take some time today. You know you've got it. There's nothing else to do around outside now. And pay attention to how you chew. It's actually quite interesting art form of how you use your tongue to move your food from side to side and front to back and all of that good stuff. So texture matters, placement matters, practicing eating matters, and all of those things help build the muscles up in your mouth for your kiddo to speak better. And so the moral of my little presentation today is, please don't take a professional's recommendation that speech therapy can wait till later, or speech therapy, you only need a teeny tiny bit of it. They'll catch on to the rest of it in life. I just feel it's false. Me personally, it's been false for us and has been false for many of my mom friends in the Down syndrome world. You need the speech therapy, and one of the ways to go about articulating this need for speech therapy is tying it in with eating safety, muscle strength, all of those things that are documented concerns for individuals with Down syndrome. And so we've had a really, really good experience in life with getting top-notch speech therapy by focusing on eating therapy. And I think it's paid off. And most of my girlfriends in the Down syndrome world would probably agree as well. So to wrap up here, again, remember, I'm not an OT, I'm not an SLP. I'm telling you the story of my life and from working with parents of kids with Down syndrome and navigating speech therapy through the feeding therapy loop. If you'd like to learn more about my experiences or how to articulate that message to your service care provider, please shoot me an email. We can set up a phone call and I can walk you through how to ask the right questions and say the right buzzwords so that you can move towards getting feeding therapy or more speech therapy in your life. I will also say that this is not just for younger kids. This can be extremely important as well for our adults as they age and we as humans lose our muscle mass. We will want to again be thinking speech therapy, feeding therapy, and how to keep our muscles active, keeping us eating safely, and being able to articulate our words so that others can say, understand us. So again, shoot me an email if you need me, ktorres@dsah.org, or better yet, go to our website and fill out the Contact Us form because there's all sorts of cool stuff on our new website. And see you tomorrow live on this page as we play board games together. All right, bye.